Now we move on to the next speaker. I now request Idoteyin Ezirim.
Okay, so thank you very much. My name is Idoteyin Ezirim, and I am a PhD student at Texila, American University, and I'm doing my PhD in public health. And I will be presenting my my thesis topic, which is HIV stigma, which has to do with HIV stigma. And this paper I'm presenting is about HIV stigma policy implementation is critical to attaining UN Zero Stigma targets. And I'll be focusing on the Nigerian experience. So this is just my presentation outline. It shows that my presentation would contain these 4 major sections: an introduction, methodology, results, and recommendations. So introduction, HIV stigma actually refers to negative attitudes and judgment towards people living with HIV or at risk of HIV. And globally and in Nigeria, it is well established that HIV stigma and discrimination is a major challenge. And one of the reasons why it is seen as a major challenge around the world and in Nigeria is that stigma and discrimination is actually a violation of the human rights of people living with HIV and AIDS. And more importantly, it is not just a violation of their human rights, it's actually a major contributor driving the prevalence of HIV and AIDS globally and in Nigeria. And one of the responses to addressing HIV stigma globally and also in Nigeria has been to enact laws and policies. And in Nigeria, the anti-HIV stigma law was actually enacted in 2014. And since 2014, there have been other policies and strategies that have also been developed, all related to addressing HIV stigma in Nigeria. And the idea was that with the coming of these policies, the coming of these laws, Nigeria will be able to create an environment without stigma. So what is the problem that this study focused on? So in this study, I focused on actually understanding the effect of these policies on HIV stigma, because yes, the policies are there, yes, the policies are being implemented, but what effect have these policies had on reducing stigma in Nigeria? That is still largely unknown. Also, whether the policies and laws have actually been effective in improving the situation of stigma for people living with HIV in Nigeria was also unknown. So this study was mainly focused on determining what has policy contributed to HIV stigma in Nigeria. So that's the main focus of this study. So in 2021, this study was conducted, and it was a cross-sectional study, and it was conducted in 16 states and the FCT. And the study population was people living with HIV and AIDS. So only people living with HIV and AIDS were enrolled on this study. And they were from general population. When you mean general population, they were men and women. And they are also key population. So people living in HIV/AIDS that were either female sex workers, men who have sex with men, or people who inject drugs. But as long as you were living with HIV within any of those classes, you're a man, a woman, or a sex worker, or MSM, or person who injects drugs, who was living with HIV and AIDS, you were enrolled in the study. And the questionnaire that was administered to the people living with HIV was a semi-structured questionnaire. And the sample size, that means we administered the questionnaire to 1,235 people living with HIV and AIDS, out of which 25% of them belongs to this special population, these key populations living with HIV and AIDS. Now, so apart from the main primary data collection that happened, I also conducted a secondary review of 2 previous stigma index studies. So this study is a stigma index survey. So was done in 2021, but there were previous stigma index studies that had been done earlier in 2011 and 2014. So I also did a review of those 2 previous studies. And the reason being that I wanted to utilize a 1 sample Z test to test differences in stigma. So in 2021, when I conducted this study, it was the laws had already been done because the laws were developed in 2014. So when I did the Z test, it was to test the difference in stigma in 2021 after development of laws, and compare it with the level of stigma in 2011 when there were no laws, and in 2014 when the laws were just developed. And this is what the results showed. The results showed that, or the Z-test showed that HIV stigma was very high in 2011 when the laws were lacking, when you compare it with 2021 after the laws had been developed and implemented. Also, similarly, the Z-test showed that stigma was also high in 2011 without the stigma laws, or than in 2014 when the laws were just developed. So when comparing the level of stigma in 2011, it was very high for compared to 2021, which is the recent study I just did, and compared with 2014, which is when the law was just developed. However, what was very interesting is when I compared the period 2014 and 2021 using the Z-test. Now look at it that in 2014, the laws were just developed, and in 2021, the laws had been developed and been implemented for a while. On comparing those 2 years, the Z-test in those 2 years, the Z-test showed that there were some forms of stigma, that there was no difference between 2014 and 2021. And there were some forms of stigma that it was higher in 2014 than 2021. So that began to confirm that with the development of the stigma policy in 2021, there was Nigeria began to experience a significant drop in HIV stigma, such that stigma wasn't so significant for some behaviors by 2021 when you compare 2014 and 2021. So the thing is, the Z-test clearly confirms that the time before laws and policies were existing, compared to the time when laws and policies were developed and were enforced and were being implemented, the HIV stigmas in both times, there was a significant difference in both. So therefore, there's no dispute that laws and policies definitely had an effect on stigma, HIV stigma reduction in Nigeria. However, it's important to note that although these laws have contributed to stigma reduction, Nigeria is still yet to achieve the UN Zero Stigma target for any of the different forms of HIV stigma in the country. And this is very important to note because since this target has not been achieved, if for any reason Nigeria does not sustain implementation of stigma laws, especially with the rising, the current fluctuation or dwindling of donor funding for HIV, if Nigeria does not prioritize implementation of stigma laws, we're likely to never achieve the zero target, or actually lose out on all the gains we have made so far in reducing HIV stigma in the country. Thank you very much.
Thank you. Thank you for the wonderful presentation. Now we move on to the question and answer session. Any questions, you can post it in the chat and Dr. Vijay will be answering. Idiotym, there is a question in the chat. I'll read it for you.
Okay.
Please clarify on your sample size. A mention of about 1,230 versus a mention of 25%, and where your target population, geographical scope, etc.
Okay, so 1,230 people living with HIV were actually recruited into the study. But remember, I said that the population of people living with HIV/AIDS were two types. There were those that were just men and women, and there were those that were belonging to special populations called key populations. Now, out of that 1, 2, 3, 5 people living with HIV/AIDS recruited in the study, there was a 25% of them belonged to that key population. So if you calculate 25% of 1, 2, 3, 5, that tells you how many of the people living with HIV/AIDS belonged to MSM, FSWs, or PWIDs that were living with HIV. So that's really what that is referring to. And the target population was not exactly just geographical scope. Of course, the participants, the PLHIVs were recruited across I mentioned the number of states that they were recruited from, but they are mainly recruited at health facilities. That's the best place to get people living HIV and AIDS. So we went to health facilities in those states to recruit these people living with HIV and AIDS into the study. Okay, somebody is asking me which forms of stigma did not improve. Actually, there has been improvement in all forms of stigma. The only thing is that it has not gotten to zero, because there is a UN target that countries are supposed to get to HIV, zero HIV stigma for all forms of stigma. So what I mean by all forms of stigma, I mean like you have forms of stigma like being excluded from events because you're living with HIV and AIDS, or being excluded from religious activities because you're living with HIV and AIDS, or even being having internal stigma because as in you feeling disadvantaged or you're not feeling confident because you feel you're living with HIV. So those are the different forms of stigma I'm referring to. So although there has been a reduction from 2011 till date, we have not attained zero for any of them. So we've not gotten to a point where we have zero stigma for any of these different forms of stigma yet. We haven't gotten to that yet. Are sex workers and men who have stigmatized due to their gender orientation? If so, was gender orientation a confounding in this study? If so, did you mitigate this confounding factor? Did stigma perception vary by gender, age, or gender orientation? Okay, so sex workers and MSMs, they didn't constitute such a big part of a study. If you notice, all the KPs just made up 25% of it, which is a very small percentage. And when you separate out sex workers, MSMs, PWID, they were not a very significant number for us to especially for me to have done this level of analysis on that. So they were not significant enough for me to have done this level of analysis on their typology. Okay, the reason I picked the Z test was because I was more concentrated on trying to understand before and after. So I looked at it in terms of before there were laws, what was it like? And after there were laws, what was it like? It's that comparison that was the crux of the issue I was looking out for, which was why I went for the Z test. Okay, has my study revealed any relationship between gay sex and HIV?
Idoteyin, thank you for the presentation and for taking up the questions. I request you to kindly leave your mail ID or contact number so that those who are interested in your presentation, they'll be reaching you out because we are running short of time and we have presenters to proceed with. So sorry for the interruption. We need to
That's
speed
fine.
up to the time. Thank you.
Okay.
Thank you, dear team, for your marvelous presentation and for taking up the questions. Kindly leave your mail ID or phone number so that the attendees and participants can reach you for further clarification. Thank you.
Okay.
Thank you, dear.
Thank you.